Welcome to the Alabama Board of Nursing's Just-in-Time Training for Nursing Regulation. This video will provide information on a recent change to the rules governing nursing practice. In 2021, the Alabama legislature granted the Board of Nursing the authority to issue permits to applicants for MAC certification. Following that, the board adopted Chapter 14 of the ABN Administrative Code, which describes the role of the Medication Assistant Certified, or MAC, freeing RNs and LPNs to concentrate on more complex and specialized nursing tasks and expanding access to care for all Alabamians. Prior to performing any duties as described within the rules, the MAC must have successfully passed the Medication Assistant Certified, or MACE, exam and receive a permit from the ABN. Then, just as with any employee, the licensed healthcare facility must assess and document the MAC's competency to perform limited medication administration for patients according to the facility's policies and procedures. MAC workers may administer medications in accordance with ABN rules and facility policy. The rule states that MAC workers may administer medications via the oral, topical, inhalant, rectal, vaginal, eye, ear, and nose routes. The MAC may also administer pre-measured medications for vaccines and medications for anaphylaxis and opioid-related overdose. PRN medications may also be administered by the MAC upon direction from the nurse, but the MAC worker may not individually determine that a PRN medication should be administered. The MAC may not have access to controlled substances in any capacity. This includes the licensed nurse removing the medication, then handing it off to the MAC worker to administer to the patient. A MAC may not access, prepare, or administer any medications via the G-tube, J-tube, or intravenous routes. MAC workers may not receive verbal or telephone orders from a licensed prescriber. They also cannot calculate medication dosages. However, MACs may measure a prescribed amount of liquid or break a scored tablet. For example, if 15 milligrams of a medication is ordered and it is supplied in 3 milligrams per 5 milliliter, this would require the calculation that 25 milliliters are to be administered to achieve the dose. So the MAC may not administer that medication. However, if the order also clearly states that 25 milliliter of the liquid medication should be administered, this is something that the MAC may administer. Licensed nurses should be familiar with this rule and their employer policy regarding supervision of MAC workers. If you still have questions, feel free to contact the ABN via email, telephone, or live chat.